They thought the new night nurse was nobody until the Marine's heart stopped in Trauma Bay 1. One flatline cut through the ER like a sentence, and suddenly titles, rank, and polished white coats meant nothing. So let me ask you this. If the person you loved was dying under those lights, would you trust the name on the badge or the hands that knew how to bring a heart back from silence? Outside Cape Harbor Medical Center, rain hammered the glass and ambulance lights bled across the parking lot. Inside it smelled like antiseptic burnt coffee wet jackets and fear. Nurses moved fast. Families prayed quietly. And in the middle of that storm stood one quiet woman everyone had underestimated. Stay with this story because before it ends, you'll see what panic hides, what real skill looks like, and how one decision can expose an entire system. Like this video comment where you're watching from, and tell me, would you have let her step in? That was the question hanging over Cape Harbor Medical Center long before anyone in that building knew how brutally the night would answer it. Wilmington, North Carolina had the kind of coastline that looked forgiving in postcards and merciless after midnight. By 1 a.m, the storm had swallowed the harbor lights and turned the streets outside the hospital into black water and reflections. Rain hammered the glass in hard slanted sheets. The parking lot shimmered under sodium lamps, every puddle cut open by ambulance tires and the restless sweep of headlights. Beyond the main entrance, the Cape Fear River was only a rumor in the dark, somewhere behind low clouds and ship horns, and the salt, heavy wind blowing in from the Atlantic. Inside Cape Harbor Medical Center, the emergency department breathed its own weather. Warm, recycled air smelled of antiseptic old coffee, wet denim bleach, and the faint iron scent that never quite left a place where blood showed up every hour in one form or another. The fluorescent lights were too bright to flatter anyone. Every face looked a little tired under them. Every silence felt temporary. Phones rang. Monitors chirped warnings that were sometimes urgent and sometimes just needy. Rubber soles squeaked over polished linoleum. Someone coughed behind a curtain. Someone else tried not to cry in the waiting room and failed quietly. Shift change was happening in fragments instead of one clean handoff because emergency rooms never really handed anything off all at once. They shed one crisis while another was still walking through the automatic doors. At the center station, charge nurse Tessa Boone stood with a clipboard tucked against one hip and the authority of a woman who had run too many nights to waste time softening her voice. She was broad-shouldered, sharp-eyed, and carried the kind of calm that came from years of seeing people break in every way a body and a family could break. She looked down at the assignment sheet and started calling rooms and complaints. 9 is abdominal pain. 12 is a head strike on blood thinners. 6 is detox and angry about being alive. 3 has been waiting too long and thinks time itself is a personal insult. Somebody keep eyes on hallway B, because if that old man pulls out his own IV again, I am not sewing him back together with kindness. A few people laughed because that was easier than complaining. Claire Bennett stood on the outer edge of the group in loose navy scrubs that did not quite fit her shoulders. She nodded once when Tessa handed her the assignment strip. "Got it," Claire said. Her voice never asked for attention. It did not rise to claim space, and it did not soften to invite it. It was the voice of someone used to being heard the first time or not at all. Her badge read Claire Bennett, RN, in clean block letters. The plastic surface had already picked up shallow scratches from weeks of night shift use. It swung lightly against her chest as she moved away from the desk and toward the charting terminals, her steps unhurried, precise, almost economical in a way that made people watch her without knowing why. New nurses usually advertised that they were new. They moved too fast, spoke too brightly, laughed too hard, or asked questions in the tone of people apologizing for not knowing enough yet. Claire did none of that. She did not move like a newcomer. She moved like someone who had learned long ago that wasted motion could cost time, and time could cost blood. Beside her, Emma, Brooks logged into the charting system with one hand and balanced a paper cup of coffee in the other. Emma was 26, 6 months into nights, and still young enough to treat every shift like it might prove something about who she was going to become. Her blonde hair was pinned back in a way that had looked neat 3 hours earlier. Now, loose strands had escaped around her temples, and the dark half-moons under her eyes told the truth about how little she had slept this week. She took a sip of coffee, made a face, and leaned closer to Claire. This tastes like somebody filtered regret through a boot. Claire scanned her patient list, checked allergies, and clicked through recent labs without looking up. That means it is fresh. Emma laughed under her breath and watched Claire's screen. You already saw the INR on 12. Claire pulled up the medication history. Warfarin. Last dose yesterday. Elevated, but not disastrous yet. You say things like that so calmly. Claire finally glanced over. Would you like me to say it dramatically? Emma grinned. A little, maybe. Claire's mouth shifted with the faintest trace of humor there and gone before it fully formed. Then she printed labels, checked a pending CT order, and headed down the hall. Bed 12 held an elderly woman with damp silver hair, a bruising cheekbone, and the embarrassed expression of someone who had not expected her body to betray her in public. Blood had dried in a thin line along her scalp and into the collar of her robe. Her purse sat on the chair beside the bed, clasped shut, as if that could keep the night organized. I'm sorry, the woman said as soon as Claire stepped in. I know you're busy. I made a mess. Claire pulled on gloves and checked the dressing with careful fingers. You fell, she said. That is not a mess. That is a reason to be here. The woman swallowed. I was reaching for the porch light and my slipper caught. My husband used to say I'd go out doing something foolish. Claire adjusted the pillow behind her head and checked her pupil response. Did he say what would happen after? The woman blinked. After what? After you got back up. A shaky laugh escaped her. It surprised both of them. I suppose he'd say I'd complain about it. Then you're right on schedule. The woman's shoulders loosened a little. It was not much, but in medicine not much was often the difference between spiraling and settling. Claire took her blood pressure, checked the scalp wound again, asked exactly the right questions, in exactly the right tone, and wrote the plan on the whiteboard in neat block letters where the patient could see it without having to ask twice. Name, nurse. Imaging pending. Monitor bleeding. Repeat vitals. Simple words were anchors in rooms like this. When Claire stepped back into the hallway, a man in bed 6 was shouting at a technician over the television volume. From triage came the brittle cry of a toddler who had gone past tired and into panic. Somewhere closer to the waiting room, a visitor was arguing with security over visiting hours as if arguing hard enough could change hospital policy biology in the hour of night. Claire did not react to any of it. Her eyes kept moving. That was another thing people noticed after a while. She saw everything, not in a nervous way, in a calibrated one. The man trying to sit still while guarding his lower right abdomen. The woman who kept pressing 2 fingers into the center of her chest, even though she had written heartburn on intake. The teenage boy in triage whose jokes were a little too loud because he was trying to hide how scared he was about the cut on his brother's face. The tiny bluish tint around an older man's lips that said his oxygen was worse than he was admitting. She charted fast. No hesitation, no pecking at the keyboard. Her fingers moved like they had spent years translating chaos into records while other people were still deciding whether to panic. Emma came up beside her with a fresh set of vitals. Room 9 says his stomach pain is nothing, which means it is probably something. Claire took the sheet, glanced once, and stood. That is usually how it works. Room 9 was a man in his late 30s with work-rough hands and the stiff posture of someone trying not to flinch because flinching might make the problem real. He had laid one forearm over his eyes when Claire walked in, but he dropped it quickly the moment she crossed the threshold as though pretending to sleep might send her away. Pain scale, Claire asked. He gave the answer men gave when fear and pride had an unhealthy child together. I'm fine. Claire pulled the rolling stool closer and started with questions instead of the exam. Where it hurt? How long? Nausea, fever, last meal, last bowel movement. She asked without hurry, never once letting his attempt at dismissing it set the pace. When she finally palpated the abdomen, his breathing changed half an inch before he admitted it did. Her hand moved lower on the right side, and the muscles jumped under her fingers. There. He sucked in a breath between his teeth. "Still fine?" Claire asked. He looked away. "I work construction. I've had worse. Work does not cause rebound tenderness." He stared at the ceiling. "You always this cheerful?" "Only with people who lie badly." He almost smiled, then winced again. That was when she knew she had him. Not the diagnosis yet. Just the truth. "I'm going to get the doctor to examine you," she said. His eyes lifted sharply. "You think it's serious?" Claire did not offer false reassurance. She had none to spare, and he deserved better than lies. "I think it needs attention." Out in the hall, she found Dr. Evan Whitaker leaning one shoulder against the physician station desk while listening to a pharmaceutical rep talk too brightly about a new formulation nobody in the ER needed at 1 in the morning. Whitaker looked as clean as if the shift had not touched him. His white coat was pressed. His shoes still gleamed. His stethoscope hung around his neck in a way that made it seem ornamental. He saw Claire coming, and the faint pleasantness he had been using on the rep vanished. "What?" "Room 9 is guarding the right lower quadrant," Claire said. "Localized tenderness, rebound. He needs an exam." Whitaker did not turn toward the patient room. "Put it in the chart." "I did." "Then I'll see him when I see him. He's getting worse." Whitaker's expression sharpened at the sound of a correction, even phrased that gently. "Bennett," he said, lowering his voice as though intimacy made disrespect more efficient. "There's a rhythm to this department. You do your tasks. You do not direct my attention like traffic." The rep looked down at her clipboard. She knew humiliation when she saw it, and wanted no part of owning witness to it. Claire's face did not change. "The patient needs an exam." Whitaker tilted his head, irritated that she had not backed down in the correct social sequence. "Do you know what nurses are best at on nights? Making themselves useful without pretending they're physicians." Emma had come within earshot by then. Claire saw the anger flash across her face. She also saw Emma bite it back because this was a hospital and hierarchy had teeth. Claire held Whitaker's gaze for one steady second. "The chart is updated." Then she turned and walked away. Emma caught up near the sink. "He is unbelievable." Claire washed her hands. Soap, hot water, thumbs, wrists, between fingers, slow enough to be thorough, fast enough not to be theatrical. "He is consistent," she said. Emma leaned against the counter. That man could insult sunlight for showing up without his permission. Claire dried her hands and tossed the towel away. "It still rises." Emma laughed, despite herself, then frowned as her eyes dropped to Claire's forearm. The sleeve had ridden up slightly with the hand-washing. Along the inside of Claire's left arm ran a long, pale scar, jagged at one edge, smoother at the other. Not like a kitchen accident. Not like a bicycle fall. Not like anything that happened in ordinary American life. Emma looked up too fast to hide it. What happened there? Claire pulled the cuff back down over the scar. "Old injury. That doesn't look old." "I mean it does, but not in a simple way." Claire met her eyes. "Most injuries aren't simple." Emma opened her mouth, then thought better of it. The boundary around Claire was visible even when she did not announce it. Not hostile. Just carefully maintained. Like a line around a minefield. The night pushed on. A child with an asthma flare needed neb treatments and a pirate sticker at the same time. A middle-aged man came in convinced his chest pain was indigestion until the 12 lead suggested otherwise. A woman with a split lip and a long sleeve pulled too far down one arm kept saying she had run into a cabinet, and no one in the room believed her, least of all. Claire, who pulled the curtain closed and stayed inside long enough for the woman to either tell the truth or know someone had noticed she was lying for a reason. By midnight, 30, even the waiting room had changed character. Wet coats dripped onto tile. The television mounted in the corner played a muted local news station nobody was watching. People slept badly in chairs or pretended not to watch the triage door every time it opened. Anxiety had a smell if you stood in a room long enough. It smelled like stale coffee, old perfume, cold rain, and people trying to control their breathing. Claire moved through it all like she belonged to the machinery instead of the emotion. Tessa noticed. Tessa noticed everything. At one point she cornered Claire near the linen cart, one arm full of warm blankets. "You've been here 3 weeks," Tessa said. "You don't gossip, you don't complain, and you chart like federal auditors are coming." Claire took 2 blankets from the stack. "That a problem?" Tessa snorted. "No. Problems are loud. You are quiet, and quiet people bother me more." Claire waited. Tessa studied her face, the way some nurses studied monitors reading subtle changes for what mattered. "You ever worked trauma before?" "Yes. That all you're giving me." It was enough. Tessa held her gaze another beat. "Fine. Try not to make me regret liking you." Claire inclined her head slightly and moved on. Tessa watched her go with a frown that was not unfriendly. Not quite trust either. Something in between. In bed, 6, the detox patient had entered the stage of withdrawal where sweat, shame, and anger all fought for the same small patch of skin. He threw the blanket off, then demanded another, then cursed when the new one was too hot. When Claire came in with meds and water, he glared at her like she had invented suffering. "You think you're better than me," he muttered. "No." "Yes, you do. I can tell." Claire checked his pulse. Tachycardic. Skin damp. Tremor worsening. "I think you're hurting," she said. He looked at her with sudden naked fury, the kind that asked whether being seen was a kindness or an insult. Then something in his face sagged. He turned away, pressing the heel of one hand into his eye socket. "Don't," he said hoarsely. "Don't what?" "Talk to me like I'm still a person." Claire adjusted his AV rate. "You still are one." That almost undid him more than the pain did. At the physician's station, Whitaker was dictating notes in a voice too crisp to be fatigued. He corrected a resident in front of 2 nurses for pronouncing ileum wrong. He sent a lab back because the label was crooked. He demanded a repeat EKG on a patient whose first one was perfectly readable, mostly because the first one had been placed by someone he disliked. The resident, Adam Pierce, had the smart, haunted face of someone who was good enough to know what he did not know yet. He trailed Whitaker by half a step and looked 10 years older every time the attending spoke. Claire passed close enough to hear Whitaker say confidence is a clinical skill, Pierce. If the room senses hesitation, you've already lost control. Pierce nodded, even though his hands were full and his eyes said he had not slept in 30 hours. Claire continued walking, but the words stayed with her. Not because they were wrong. Because they were incomplete in a way that killed people. Control was not the same thing as competence. Some men spent entire careers confusing the two. By 1:15, the storm outside had gotten worse. Wind rattled the ambulance bay doors. Rainwater slid down the windows in crooked silver lines that distorted the red and blue flicker of distant emergency lights. Somewhere beyond the parking lot, a ship horn groaned across the harbor, low and mournful enough to sound like a warning. In the supply room, Claire counted IV catheters and found the drawers half empty again. She straightened the packaging while she was in there, not because anyone had asked her to, but because order was a kind of mercy when the room outside was full of noise. Gauze in one stack. Saline flushes aligned. Tape rolled forward so the ends could be found by touch. Expiration dates checked. Suture kits rotated. Whitaker appeared in the doorway before she heard his footsteps. "You disappeared." Claire glanced up from the shelf. "I'm restocking. I didn't assign you to housekeeping. And yet supplies still run out when we ignore them." The sentence was mild. Too mild, maybe, because Whitaker heard the edge in it anyway. He took one step into the room, crowding the narrow doorway with his coat in irritation. "There's a habit among night staff," he said. "You all start thinking efficiency gives you authority." Claire set the last saline bag in place. "No, competence does that." For a moment, the tiny room held nothing but the hum of fluorescent light and the storm tapping hard against the outer wall. Whitaker's eyes narrowed not because she had raised her voice, but because she had not. Calm defiance offended men like him more than emotion ever could. You have got to stop forgetting who you are here. Claire turned to face him fully now. She was not taller than him, not broader, not louder, but she had a stillness that changed the shape of the doorway between them. "No," she said quietly, "I remember." Whitaker opened his mouth, then shut it again. Something about her expression threw him off balance for half a second. He stepped back with an annoyed gesture as though he had chosen to end the exchange on his own terms. "Stay visible," he said as he moved away. "If I need you, I don't want to have to hunt you down." Claire walked past him carrying 2 IV start kits and a box of flushes, her face unreadable. Emma was waiting at the station and read the atmosphere immediately. "Was that about the supply room?" Claire set the kits down. "Partly." Emma rubbed her forehead. "I swear, if arrogance were a billable procedure, he'd fund the whole hospital." Claire sat at a terminal and began charting, then let him pay for his own personality. Emma barked a laugh so loud that Tessa looked over from the phone and gave them both a glance that meant keep moving. They did. The next hour did what emergency department hours always did. It passed slowly in the moment and vanished in memory. A man with a fishhook through his thumb refused pain medication until he actually saw the fishhook. A college student arrived with a panic attack and apologized for wasting everyone's time until Emma sat with her long enough for her breathing to stop sounding like drowning. A sheriff's deputy brought in a handcuffed woman with a split brow and eyes like broken glass. A janitor mopped the same patch of floor twice because the rain had made the entrance slick. Someone's family sent flowers to the wrong room. Someone else got bad news over speakerphone in the hallway because there was nowhere private left. Through it all, Claire remained exactly what she had been at the beginning of the shift. Measured, quiet, almost impossible to read, but not impossible to watch. Emma watched how patients responded to her. The scared ones calmed. The angry ones ran out of steam faster. The dramatic ones stopped performing when they realized Claire would not feed it or mock it. Even the men, who bristled at being told hard things, usually listened by the second sentence because she spoke to them as if honesty was a right, not a punishment. It unsettled Emma a little. Not in a bad way. In the way real competence always unsettled people who had mostly seen confidence mistaken for it. Around 1:40, Claire paused at the nurse's station and looked down the hall toward trauma. There was no siren yet. No incoming overhead alert, nothing obvious. But Emma, standing close enough to notice, saw the shift in Claire's eyes. Not alarm. Readiness. As if some private part of her had come awake at a sound too far off for anyone else to hear. "You okay?" Emma asked. Claire's gaze returned to the computer screen. "Yes." Emma hesitated. "You ever think about leaving nights?" Claire clicked through a medication reconciliation and replied without inflection. "I came here because nights are quieter." Emma looked around at the phones, the waiting room, the coughs, the shouting visitor near the entrance, the tech sprinting past with a urine sample. "This is quieter to you." Claire almost smiled, but not quite. "Yes." That answer stayed with Emma, not because it was strange, because it sounded true. Down the hall, Whitaker emerged from the physician room with Adam Pierce behind him. Pierce was carrying a portable ultrasound he had obviously been sent to retrieve. Whitaker checked his watch, irritated already by the hour that paced the people around him. Claire watched him for 1 second, then looked away. Whatever history she carried it like locked steel. Nobody here had the key yet. At the front desk, a clerk slid a new chart into the rack and muttered, "Walk-in chest pain. 48, says it's probably nothing." Tessa looked up. "That usually means it isn't." Claire was already moving. "I'll take him." And that was the rhythm of the place. One need closing over another. One body replacing the one before it. One room emptying as the next filled. The storm pushed harder at the windows. Somewhere in triage, a man started yelling about the wait time and the hidden conspiracy of hospitals. Security answered with the patient dead calm of men who had heard every variation before. A child cried because his arm hurt. A husband paced because his wife was behind a curtain and nobody was telling him enough. Emma stapled discharge papers together while trying to keep up with new orders. Tessa argued with bed control upstairs about a room that did not exist. And in the middle of it, Claire Bennett moved like a shadow made useful. If anyone in Cape Harbor that night had asked what made the quiet nurse different, they might have pointed to the scar, or the posture, or the way she never hesitated around blood, or the way Whitaker seemed to dislike her with unusual intensity, as if some part of him sensed without understanding that she was dangerous to the kind of certainty he wore like a polished surface. But the truest answer was simpler. She was the only person in that department not pretending that chaos could be managed by status alone. At 1:47 a.m., the red EMS line mounted on the wall by the charge desk rang once sharp enough to cut through every other sound in the room, and every head turned. The red EMS line rang once sharp enough to cut through every other sound in the room. Then it rang again. Tessa Boone reached for it, but Claire got there first, lifting the receiver with one smooth motion that looked less quick than inevitable. "Cape Harbor emergency," she said. "This is Bennett." She listened. The room kept moving for the length of a breath, then slowed around her. Emma watched the change come over Claire, the way the sky changed before lightning. Not louder, not colder, just stripped down to essentials. Claire's eyes fixed on nothing as the medic spoke into her ear. "Copy," she said. "What's the ETA?" A beat. "Under 8, understood. Trauma Bay 1. Blood ready on arrival." She hung up and turned. 3 inbound from a pileup on Highway 17. 1 critical. Male, early 30s. Pinned for 40 minutes. Penetrating injury to the left chest and upper abdomen. Pressure falling. Marine. Whatever looseness had been left in the department tightened into shape. Tessa was already moving. Emma, fluid warmer. Adam, get the airway card checked. Blood bank now. She snatched up the red phone, barking toward the lab before anyone had fully processed the report. "I need O negative to trauma 1, Mu." Dr. Adam Pierce grabbed the ultrasound and the chest tube tray in the same awkward sweep and nearly clipped the corner of the counter. Whitaker came out of the physician's station with his expression already annoyed, as if emergency had chosen an inconvenient moment to become real. "What's the code status?" Claire answered before anyone else could. "Trauma activation. Penetrating thoracic injury. Hypotensive in transit." Whitaker gave her a thin look. "I decide that." Claire held his gaze just long enough to make him hear the numbers behind her voice. Blood pressure 80/40. Pulse 130. Decreased left side movement per EMS. He has been trapped 40 minutes. Whitaker's jaw shifted. He did not like being cornered by facts, especially not hers. "Fine," he said. "Trauma Bay 1. Pierce with me. Boone call radiology and surgery standby. Bennett, charting and prep. Then stay clear." "Yes," Dr. Claire said. She turned before the sentence finished and walked toward Trauma 1. People parted without thinking about it. Trauma. Bay 1 was colder than the rest of the ER and brighter in a punishing way. Fresh sheets on the gurney. Stainless steel surfaces wiped down and waiting. Suction canister empty. Airway drawer stocked. Sharps container half full. A room built for disaster and always a little hungry for it. Claire stepped inside and her movements changed again. She checked the wall oxygen, the suction tubing, the intubation setup, the chest tube instruments. She laid out towels, clamped a line, repositioned the overhead light by half an inch, and made space on the left side of the bed without being told. Emma came in behind her, carrying warmed saline and extra gloves. "You've done this before," Emma said, breath tight. Claire hung a gown where it could be reached in one grab. "Yes." That was all. Emma swallowed and started priming lines. Outside, the ambulance bay doors groaned open under wind. Rain blew in with diesel exhaust and wet tire rubber. A second later, the stretcher came through hard and fast, medics shouting over rattling wheels. The patient on the gurney did not look like a man who should still be alive. His camouflage blouse had been cut from collar to waist. Blood had soaked the fabric so dark it swallowed color. His skin was gray beneath the grime with the hollow sheen of a body withdrawing from its edges. A jagged section of metal wound had torn through the left chest below the nipple line and tracked down toward the upper abdomen. The object itself had been cut short in the field, but the violence of its path remained printed across him. Every breath sounded wet and expensive. The lead paramedic kept one hand braced to keep the body from sliding as they rolled. Gunnery Sergeant Luke Callahan, United States Marine Corps. 32, he shouted. Single vehicle rollover became secondary pileup in storm conditions. Driver side intrusion. Pinned 40 minutes. Heavy blood loss at scene. Metal entered left thorax and upper abdomen. We cut external segment for extrication. Pressure kept trending down. Gave fluids no meaningful response. Diminished left breath sounds. He's altered and fading. Transfer on 3, Whitaker said. 1, 2, 3. They moved Luke to the trauma bed. His head rolled to the side. For 1 second his eyes opened unfocused under the brutal lights and found nothing. Respiratory fitted the mask. Pierce reached for the monitor leads. Emma was at the right arm with an IV set up. Tessa slapped the blood pressure cuff on and called for blood again. Whitaker leaned in, airway. Patent for now, respiratory said. He's tiring. Breath sounds. Pierce listened high, then low face tightening as he moved the stethoscope. Decreased left. Maybe absent at the base. Whitaker nodded, already locking onto the first familiar algorithm. Chest tube tray. We decompress. Claire stood half a step behind the shoulder line and watched Luke's neck instead of his chest. The jugular veins were standing out too prominently for someone bleeding like this. Not ropey from strain. Distended. His pulse on the monitor was fast and thin. The waveform looked starved. Each inspiration seemed to fight an invisible hand. Tessa called out, pressure 82/46. Emma cut away more fabric from the wound track and tried not to stare at the amount of blood under her gloves. Claire took 1 step closer. Doctor. Whitaker kept his eyes on the left chest. No, she did not raise her voice. Look at his neck. That earned her a sharp glance. Back away, Bennett. Claire didn't. Listen to the heart again. Pierce hesitated, then obeyed, without fully deciding to. He moved the stethoscope to Luke's chest and listened longer this time. His brow furrowed. They're muffled, he said, I think. Whitaker snapped. Everything is muffled in a trauma bay. He has a chest injury and dropping sats. We decompress. It's not just the chest, Claire said. Whitaker turned on her, then anger, already carrying the scent of fear. You do not diagnose over me. Luke coughed under the mask. A dark, wet bubble touched the corner of his mouth. His left side barely lifted. The veins at the base of his neck seemed wrong in a way Emma could not have explained, but once Claire had said, "Look," Emma could not stop looking. Claire spoke again, still calm, which only made the room hear her more. Penetrating chest trauma. Hypotension. Distended neck veins. Muffled heart sounds. He's tamponating. The word hit Pierce visibly. It rearranged his face. Whitaker laughed once without humor. That's a board review answer, not a trauma bay answer. It's physiology, Claire said. Luke's pulse oximeter dropped to 89. The monitor alarm chirped. Respiratory adjusted the mask and looked at Whitaker. Decision. Whitaker held out a hand, scalpel. Pierce passed it. Claire watched Whitaker prep the left side too quickly. The movement was practiced, not thoughtful. The kind of speed that looked authoritative from a distance. If you put in a tube before relieving the pericardium, she said quietly, you will not solve the reason he's dying. Whitaker never looked at her. Amazing. A lecture. Tessa's eyes flicked between them. She had worked with enough men like Whitaker to know the moment when pride started overriding judgment. She did not like that moment. She liked it even less on a body this unstable. Evan, she said, using his first name the way only very senior nurses could take another listen. Whitaker's head snapped toward her. "Stay in your lane, Tessa." That shut the room by half a degree. Not because anyone agreed with him, because hierarchy once sharpened made cowards of decent people. Emma felt it all at once. The rules, the fear, the way one voice with enough letters after it could silence a room full of instincts. Then Whitaker cut. The incision opened. Dark blood came hard and heavy. Not air under pressure, not the release he had been expecting. The suction hissed. Pierce inserted. Emma held gauze. More dark blood poured. Luke's numbers worsened. 74/38, Tessa called. Respiratory looked up. He's tiring out. He's not going to maintain. Whitaker's confidence flickered for the first time, then hardened into performance. Prepare RSI. Etomidate, succinylcholine. We take the airway now. Claire moved before the sentence finished. He will crash if you sedate him. Whitaker rounded on her. Enough. Pierce looked from Whitaker to Claire and back again, the stethoscope still hanging around his neck like a question. Luke's eyes opened once more. This time they found Claire. Not because he recognized her. Not yet. More because the human brain right before the edge sometimes reaches for the stillest thing in the room. His lips moved under the mask. No sound came. Claire stepped in close enough for him to hear if hearing was still possible. "Stay with me, Marine." The monitor broke apart into ventricular fibrillation. Emma's hand froze over the syringe. Refib. Whitaker reacted instantly because algorithms had always been safer to him than ambiguity. Start compressions, charged to 200. Pierce climbed onto the stool and began compressions. Luke's body jolted under the force. The wound on the left chest bled more freely. Emma's stomach turned. Claire watched the sternum rise and fall uselessly under Pierce's hands and knew exactly what they were doing. They were squeezing a heart that could not fill because it was trapped inside a sack of blood. They were pounding on mechanics while the real problem sat untouched one layer deeper. "Stop," she said. No one did. Whitaker shouted over her, "Keep going." Claire's voice sharpened, not louder but final. "Stop." Pierce hesitated. The next compression landed half-committed. The line on the monitor straightened. One long tone filled the room. Flatline. No waveform, no pulse, just that hard sound, merciless and clean. For half a second, every person in Trauma Bay 1 went still. Whitaker inhaled to take back control of the room. Resume compressions. Clear the bed. We shock if it returns. Move. Claire stepped forward and put one hand on Pierce's shoulder. Not violently, just enough to hold him in place. No. Whitaker stared at her as if she had crossed a border into insanity. Get away from the patient. Claire kept her eyes on Luke's chest. Compressions will not fix a heart that cannot expand. "You are a nurse," Whitaker said, and now the word sounded like an accusation. "Yes." "Then do your job." Claire looked at him, then finally, and what Emma saw in her face was not rebellion, not ego. It was the certainty of someone who had already measured the distance between rules and death. "I am." Whitaker pointed to the doorway. Security. 2 guards appeared, pulled by the shouting and the alarm tones, then stopped at the threshold. One look at the room made them hesitate. Blood everywhere. A dead Marine on the table. A doctor, raging. A quiet nurse standing like the axis of the room had shifted under her feet. Whitaker's gloved hand shook. "Remove her now." No one moved. Claire extended her left hand without taking her eyes off Luke. "Retractor." Emma stared at her. The room contracted around that single word. Every policy she had ever been taught rose up at once. Scope of practice, chain of command, incident review, termination, license, lawsuits. Everything the hospital worshipped when it needed to avoid blame. Then Emma looked at Luke's face. Gray. Empty. 20 seconds deeper into death because the wrong man needed to be right. Her hand moved before the fear finished arguing. She snatched the retractor from the tray and placed it in Claire's open palm. Whitaker lurched forward. Absolutely not. Claire took the scalpel in her right hand. If I do nothing, she said, he stays dead. Then she made the incision. Not wild. Not trembling. One clean line through skin and subcutaneous tissue at the left anterolateral chest. Deeper with the second pass. Blood welled hot and dark. Pierce made a strangled sound. Emma's breath caught in her throat. Tessa, who had seen open abdomens and burst aneurysms and more bad nights than anyone should, went utterly silent. Claire changed instruments without looking. She cut through intercostal muscle with quick, efficient movements, found the space, widened it. Retractor. Emma repositioned closer, hands shaking so badly she thought she might drop it. Claire placed it between the ribs with the confidence of long memory and opened the chest. The room gasped. Inside was blood-glistening tissue, the awful intimacy of a human body, forced past its proper boundaries. Claire took the suction from Emma. Suction on. It whined, alive. She cleared the field in 2 passes. Her face did not change. Her breathing stayed even. Whitaker stood frozen now at the edge of his own trauma bay rage and disbelief, fighting for control of the same expression. "This is insane," he said. Claire ignored him. There, bulging under pressure, lay the pericardium, distended, dark, tense as a drum. "There you are," she murmured low enough that only Emma heard. Forceps in, lift, small controlled incision. The sac opened and blood released in a thick rush. The pressure in the cavity changed instantly. You could feel it even without understanding it, the way a room feels different after a lock gives. Under Claire's fingers, Luke's heart twitched. Emma made a sound halfway between a sob and a laugh. It moved. Claire did not look up. "It's trying." She slid her hand, encupping the heart with impossible familiarity, and began internal cardiac massage. Not frantic. Rhythmic. Purposeful. Guiding the muscle back toward motion. Epinephrine. Emma moved. The order cut through her shock better than any reassurance could have. She drew the drug with trembling hands, found the port pushed. Epi in. Claire kept working. "Come on." Whitaker found his voice again because silence was finally more threatening than noise. "Time of death 2:03. Tessa turned toward him so fast her chair wheels banged the cabinet. "No," she said. It was the first time all night anyone had challenged him with full volume. Claire never looked away from the heart in her hand. A twitch, then another. The flat line broke. One beep, then a second. A narrow green rise crawled across the monitor like life relearning itself. Pierce stared. Electrical activity. Tessa grabbed Luke's carotid with 2 fingers. Her eyes flew wide. "Pulse. I have a pulse." The room exhaled in fragments. Emma gripped the edge of the cart hard enough to hurt. Pierce took a half step back as if the laws of medicine had just shifted under him. Even the guards at the door seemed to forget why they had been called. Claire kept her hand where it was for 2 more beats, feeling the filling pattern. Judging output, reading tissue the way other people read words. Then she reached deeper and changed her hand position. Pierce swallowed. "What are you doing?" "Maintaining perfusion. That's the descending aorta," he said, the realization landing as he heard himself say it. Claire found the vessel by feel and compressed. Luke's pressure crept upward on the screen. Tessa called it disbelief, cracking the edges of her voice. 90 systolic. "Blood," Claire said. "On the way. It is never on the way fast enough." Whitaker stood at the side of the bed, white beneath the fluorescent lights now, as though the room had turned around and shown him what real competence looked like, and he could not bear it. Claire finally looked up. Her face was streaked with blood, not much, but enough to mark her as someone who had entered the problem instead of speaking around it. "Call the OR," she said. No one moved for 1 second, not because they disagreed, but because everyone in that room understood they had crossed into a different kind of night. Claire's voice hardened by a single degree. "Call the OR and tell them we are coming with an open chest." Tessa reached for the phone. Her voice, always hard-edged and practical, turned even flatter when people were dying. "This is Boone in Trauma 1. We need OR now. Open chest. Penetrating thoracic trauma. He has a pulse and no time. She listened for 1 second, then cut the line before the answer fully finished. "They're clearing a room." Claire never looked up from Luke's chest. "Good. Blood at bedside. Warm it, keep the airway stable. Adam, do not let him buck. If he loses pressure, tell me before the monitor does." Pierce swallowed and nodded, the motion jerky and obedient. Right. Emma was already spiking blood. Her hands still shook, but the shaking had narrowed into something functional. Fear did not leave. It just got busy. Whitaker stood near the foot of the bed, as if he had been pushed there by invisible hands. His mouth opened once, then shut. It was not that he had nothing to say. It was that every sentence he had ever trusted had suddenly become useless in the room with the heart beating under someone else's hand. Luke's blood pressure climbed and wavered in small, fragile increments. 91 systolic, 88, 92 again. Enough to move, not enough to feel safe. Respiratory adjusted the mask and called out his saties. Pierce steadied the line at Luke's neck and checked the chest tube output with wide eyes, still trying to reconcile what he had just watched with what he thought medicine was supposed to look like. Claire shifted her stance, one knee braced against the frame of the bed, one hand still inside the thoracic cavity, keeping control by feel more than sight now. "Pack around the wound," she said. Emma placed the laparotomy pads into her waiting hand. More. Another pack. Another, blood soaked through almost instantly. "Tessa, tell them he is exsanguinating, and we are not stopping in the hall for paperwork." Tessa did not answer with words. She was already moving around the bed, clearing tubing, checking the transport monitor, throwing open a cabinet for more saline. All of it with the tight, concentrated fury of a nurse who had just watched every internal lie of hospital hierarchy catch fire in under 10 minutes. At the doorway, one of the security guards finally found his voice. "Do you need us to clear the corridor?" Claire looked up for the first time, eyes steady, face marked by blood and work. Yes, that was enough. The guard turned and ran. Whitaker stepped forward by half a pace, grasping at authority, because it was the only rope he had ever trusted. This patient should have been pronounced. No one answered him. He looked at Pierce, then Emma, then Tessa, but none of them gave him the thing he wanted, which was agreement, or fear, or even attention. Claire glanced once at Luke's face. The gray had not disappeared, but it had retreated from the edge. The body was still fighting, weakly, expensively. But it was fighting. "Move," she said. The wheels unlocked. The bed lurched forward. The run to the operating room turned the hospital into a blur of fluorescent light, reflected tile, and startled faces. Blood bags swayed from raised poles. The transport monitor beeped an angry, fragile rhythm. Tessa pushed from the right side, a tech from the left. Pierce stayed at the airway, eyes fixed on the tube and chest rise, as if looking anywhere else would lose them something. Emma moved beside Claire, handing over gauze, keeping lines untangled, swallowing panic, one dry breath at a time. They tore past the waiting room entrance, where 2 visitors stood up so quickly their chairs crashed backward. A janitor flattened herself against the wall mop, still in hand. Somewhere a child asked too loudly what happened to him. No one answered. The elevator opened, and they packed inside it with impossible care. Too many bodies, too much equipment, too much blood in a metal box meant for normal hospital use. Claire did not shift her hand, even when the cab jolted upward. She watched Luke's monitor and felt his pressure through tissue and resistance and the remembered geometry of anatomy. Emma, standing shoulder to shoulder with her in that cramped, bright space, realized something then that had nothing to do with job titles or protocols. Claire was not improvising. Nothing in her body said improvisation. She knew exactly where she was inside the chest, exactly what she was holding, exactly how much pressure to apply and where not to slip. The elevator doors opened onto the surgical floor. The OR team was waiting with the stunned, sharpened focus of people who had been told something impossible and now had to live in it. A scrub nurse with 30 years in her posture took one look at the open thorax and did not waste a single syllable on surprise. The anesthesiologist stared for only half a beat before moving into position. "Who did this?" he asked, voice flat with disbelief. Claire answered before Whitaker could reach the front of the group. Pericardial tamponade relieved in the ER. Internal massage achieved return of spontaneous circulation. Ongoing hemorrhage. Likely ventricular injury. Suspected abdominal extension. The anesthesiologist looked at her, then at the hand still inside the chest. "And you are busy." That was all she gave him. Then the doors to the OR swung wider, and Dr. Nathan Voss strode in, tying the last loop of his gown as he moved. He was in his late 50s, broad across the shoulders, silver at the temples, and carried the kind of fatigue that suggested he had forgotten more surgery than most people ever learned. Rain still darkened the edges of his hair. He had been called out of sleep and into catastrophe, and looked irritated only by wasted time. He reached the table, took in the field, the packing, the hand control, the pressure holding on the monitor, and paused. His eyes landed on Claire's left hand. That pause told the room more than any praise could have, Report Voss said. 32-year-old male, Claire said. Penetrating trauma through left thorax into upper abdomen. Profound hypotension on arrival. Neck veins distended. Muffled heart sounds. Chest tube did not correct hemodynamics. He arrested in Trauma 1. I opened the chest-relieved tamponade, performed internal massage, and manually compressed the descending aorta. Pressure is tenuous. He is still bleeding below. Voss looked once at Whitaker, who had just entered the room with all the stale energy of a man arriving late to his own collapse. Whitaker opened his mouth. I was managing the trauma until she interfered. Voss ignored him. He leaned in over the chest and studied the temporary control that Claire had created with what the ER had available. His eyes narrowed not in criticism, in recognition. "Hold there," he told her. Claire held. Good. The word was quiet, but Emma heard it from the wall and felt it travel through the room like a verdict of a different kind. Voss scrubbed fully while the anesthesiologist got access numbers, drips, breath sounds, and blood products moving in something closer to true order. The OR lights burned down white and merciless over Luke's body. Steel clinked against steel. Suction roared. Warm blood hit the basin in thick, dark streams. Once Voss stepped into the field, the room shifted again, not away from Claire, but around the fact that there was now another pair of hands in the building, capable of taking over without undoing what she had done. He found the ventricular injury after 2 passes of suction and a retracting adjustment. "Right ventricle," he said. Claire nodded once, yes. Voss gave her a brief look. Not surprise now. Confirmation. He worked fast, and with the kind of precision that did not need spectacle. Temporary control became suture repair. Pressure became hemostasis in increments, then setbacks, then increments again. The abdomen demanded attention too. A second surgeon arrived. More clamps, more sponges, more blood. The language of the room narrowed into essentials. Claire stayed until Voss replaced the work of her hand with the certainty of his. Only then did she step back. The absence of immediate action hit her all at once. Not weakness exactly, just the body realizing too late how much force it had been holding in place. Her forearm ached deep into the elbow. Blood had dried tacky along one side of her jaw. Her scrubs were stiffening at the front. Emma stood near the wall gloves, red face pale, and watched Claire with the stunned loyalty of someone who had crossed a line and found that the person on the other side had been worth following. Voss placed the last repair stitch, checked for bleeding again, and listened to the numbers being called from anesthesia. Pressure stabilizing, rhythm steady, urine output coming back. The room exhaled. Luke Callahan remained critical. Ventilated, opened, repaired, and barely hanging on. But alive. Alive enough to make the night answerable to itself. Voss stripped one glove, then the other, and turned. His first look was not for Whitaker. It was for Claire. He studied her face for a beat too long to be casual. Saw the old steadiness there. The exhaustion beneath it. Something half-buried that had not come from civilian ER work. "Who trained you?" he asked. Claire reached for a towel and wiped one hand clean enough to keep from dripping. A long time ago. Voss kept looking. Whitaker stepped in desperate now to reclaim 1 inch of ground. Nathan, she is not privileged to touch a scalpel in this hospital. She assaulted the chain of command and performed an unapproved thoracotomy in the ER. Voss did not turn toward him. You had a dead Marine on your table. I was following protocol. Voss finally looked at him then, and the temperature of the room seemed to drop. You were following your comfort. Whitaker flushed darkly. That is not fair, no, Voss said. Fair would have buried him an hour ago. Silence again. Claire did not stay for the rest of the closure. She had already given the room what only she could have given it. A scrub nurse pressed a towel into her hand and she cleaned under her nails as best she could without pretending it would matter. Blood stayed in the cuticles. Some nights left marks no soap respected. Outside the OR, the hallway felt too quiet for what had just happened. The noise rushed back in. The phones. The distant overhead page. The squeak of wheels. The ordinary machinery of a hospital trying to keep itself from becoming a theater even when it already had. Tessa was waiting outside the doors, arms folded, face hard. He's heading to ICU after recovery. Claire nodded once. Tessa looked at her harder. I watched you put your hand around that man's heart and drag him back into this building. Claire said nothing. Tessa's expression shifted not into softness but something more useful. Respect stripped of sentiment. Good, she said. Now let's go deal with the paperwork circus. They rode the elevator down in silence except for Emma, whose breathing was still not quite under control. On the mirrored wall, the 4 of them looked like survivors of different disasters. Tessa, with blood on her cuff. Emma, with dried red streaks near one elbow and eyes too wide. Claire, in ruined scrubs, face scrubbed only halfway clean, staring at nothing. Whitaker, immaculate except for one fleck near his sleeve, already reorganizing himself into grievance. The ER had changed in the short time they were gone. People knew something had happened, even if they did not know what. Staff clustered too close to the nurses' station. 2 local officers stood near the counter. Simon Graves, hospital administrator, hovered nearby in a pale dress shirt damp at the collar, the human shape of institutional panic. The mounted television in the waiting room had switched from weather to local news, muted, but crawling with red graphics and urgent faces. Whitaker stepped off the elevator and found his voice before his feet fully touched the floor. There, he said, pointing at Claire. That is the staff member. Officer Rachel Torres turned. She was in her 30s, square-jawed hair pulled back tight with the patient expression of someone accustomed to sorting lies by the sound they made. What happened here, she asked. Whitaker moved toward her, controlled and righteous now that uniforms were present. We had a trauma patient. I was directing care. She physically overrode my resident-ignored orders, performed a highly invasive, unauthorized procedure, then obstructed resuscitation. This is criminal negligence at minimum. Emma stepped forward before fear could stop her. He was dead. Whitaker snapped around Emma. She flinched but did not back up. He was dead, and she brought him back. The second officer looked between them, uncertain. Simon Graves cleared his throat and tried to make his voice sound authoritative. Officers, the hospital intends to cooperate fully. But this matter may involve severe liability exposure and credential fraud. Claire stood in the middle of all of it. Shoulders relaxed. Hands raw and pink from a rushed scrub, blood still visible where the water had not reached. She looked at Officer Torres and did not look away. I'll give a statement, she said. Whitaker laughed sharply. You don't get to control this. Claire ignored him. Torres glanced at the blood on Claire's clothes, then at the tray someone had left half-covered near the wall, the metal instruments stark and undeniable under fluorescent light. Ma'am, she said carefully, I need to understand whether you are a licensed provider. Before Claire could answer, Voss emerged from the elevator behind them, still in partial OR dress. He walked straight past Whitaker and Graves and stopped near Torres. The patient is in ICU, he said. Critical but alive. Torres blinked once. Alive. Yes. Whitaker threw out both hands. Because I kept the room together long enough for OR transfer. Voss turned his head just enough to cut him with a look. No. Because she relieved a tamponade you failed to recognize. The waiting room quieted around that sentence. Staff members who had been trying not to stare now stopped pretending. Whitaker's face went hard. Nathan, be very careful. Voss did not even bother with contempt. I am. Claire reached into her scrub pocket. Every eye followed the movement. Whitaker seemed to think he had finally caught her doing something visibly wrong. Instead, she drew out a compact black phone that did not belong in civilian hospital life. Not a cheap smartphone. Something harder, utilitarian, unmarked. Tessa saw it first and felt with clinical certainty that the floor under the hospital had just shifted again. Claire dialed from memory and lifted the phone to her ear. When she spoke, her voice changed not in accent, not in volume, but in authority. The room heard command in it before anyone understood the words. "This is Mercer," she said. "I am compromised. Cape Harbor Medical Center, Marine patient alive. I need legal and containment." The line on the other end spoke for only a second. "Yes," Claire said, "now." She ended the call and lowered the phone. Whitaker stared. "What is that?" Claire put the phone back in her pocket. No one answered him because the elevators opened before anyone could. 4 men stepped out in dark suits that looked too dry for the storm outside and too expensive for hospital maintenance. Their eyes moved once across the ER and settled where they needed to settle. At their center walked a tall man with a narrow scar at his temple and the kind of expression that turned crowded rooms quiet without effort. He looked directly at Claire. "Colonel." The word landed like dropped steel. Simon Graves went visibly pale. Emma stopped breathing for a moment. Tessa's mouth tightened into something that might have been satisfaction. Voss folded his arms and watched. The man approached Officer Torres first, producing identification too quickly to be theatrical. "Grant Maddox," he said, "Department of Defense." Torres read the credential, and whatever she saw on it rearranged her posture by half an inch. "This is a civilian hospital," she said. Maddox nodded. "Tonight, it is also a federal problem." Whitaker scoffed because disbelief was the last refuge he had. "This is absurd." Maddox turned his head toward him. "Dr. Evan Whitaker." Whitaker straightened. "Yes." "Stop talking." That hit the room harder than shouting would have. Maddox opened a slim black folder and withdrew a single laminated card, then a second sheet. He laid them on the counter in front of Torres and Voss. The photograph showed Claire younger by a few years, harder in the face, the same eyes, and none of the softness civilian anonymity had tried to put over them. The name beneath the photograph was not Claire Bennett. It was Lieutenant Colonel Claire Mercer, M.D., Medical Corps, Special Operations, Surgical Augmentation. Emma looked from the card to Claire and felt the last of her assumptions die cleanly. Not because Claire had lied in some simple way, because whatever this was had begun long before Emma had ever met her. Simon Graves made a sound that was almost a laugh and almost a collapse. "We hired a lieutenant colonel as a staff nurse," Maddox answered without humor. "You hired someone who wanted not to be found." Whitaker's mouth twisted. "This changes nothing." She still acted outside hospital privilege. Claire finally spoke again. "He had arrested." Whitaker shot back instantly. "Because of the injuries I was managing." Voss cut in calm and lethal. "Because you chased the wrong diagnosis while she watched a man die." The television above the waiting room, still muted, shifted to a split image. One side showed the hospital entrance under rain and flashing lights. The other showed a studio anchor in a navy suit. Then the caption appeared across the bottom in red. "Miracle or malpractice at Cape Harbor Medical Center." A blurred, still image flashed next. Trauma Bay 1, caught from an angle it never should have been visible from. Blood, motion, the bright glint of instruments. A figure in scrubs leaning over an open chest. A visitor had filmed it. Or a patient, or someone in the waiting room who thought all extraordinary moments were public property if they were close enough to a phone. Tessa looked up at the screen and swore under her breath. Emma's face drained. They posted it. Maddox looked at one of his men. Take it down. The man did not bother pretending. We'll try. Whitaker turned toward the television like a starving man smelling food. The story had escaped the room now. That meant it could still be shaped. And then the studio anchor gestured to a guest already waiting in the next frame. Dr. Evan Whitaker, earlier. Cleaned up, hair set, tie straight, calm, controlled. Speaking in the polished cadence of a man who believed the camera could restore what reality had taken from him. The ER watched in silence as his recorded interview rolled over the muted screen. Caption beneath him. Cape Harbor physician speaks out after chaotic emergency surgery. Even without audio, the confidence of his body language was sickeningly clear. He was already telling the story. Claire stared at the screen. Her face gave away almost nothing, but Emma, standing close enough to notice small things now, saw the slightest tightening along her jaw. Maddox followed her gaze. He moved fast. Claire wiped one thumb against the heel of her palm where dried blood still clung. Men like him always do. Around them, the ER was no longer merely tired or afraid. It was divided. Curious patients craned their necks. Staff glanced between the screen, Claire, the men from the Defense Department, and the officers near the desk. The whole place had the unstable charge of a storm cell deciding where to break. Upstairs, in ICU, Luke Callahan was breathing through a machine because Claire had refused to let him die. Down here on television, the man who nearly killed him was already trying to own the truth. Claire looked away from the screen and toward the elevators again, as if measuring the hospital by exit sightlines, an old instinct instead of architecture. Maddox noticed. "What is it?" he asked. Claire did not answer right away. She listened instead, not with her ears alone, with the full stillness of someone who had spent too much of her life learning the difference between noise and threat. The ER was loud in all the ordinary ways. Phones, shoes, rain against glass. A child asking a question no one had time to answer. The low murmur from the waiting room where strangers had already begun to turn Luke Callahan's blood into a story they could carry home. But beneath it all, under the fluorescent hum and the television graphics, and Whitaker's furious breathing, there was another pressure now. Not sound exactly. Timing. Claire turned back to Maddox. "Where is he?" "ICU," Maddox said. "Trauma recovery floor, under watch." Claire's gaze sharpened. By who? Maddox understood the question beneath the question. "Hospital security and one of mine in the hall." "One man," Claire said. Voss heard it and looked up from the chart in his hand. "He is post-op and intubated. Nobody is getting near him." Claire's eyes did not leave Maddox. How many people know he survived? No one answered immediately because the answer was obvious. The paramedics knew. Everyone in Trauma 1 knew. The OR team knew. The local officers knew. The waiting room knew enough. The internet knew enough to get dangerous. And somewhere beyond the walls of Cape Harbor, anyone who had wanted Luke Callahan dead might already know that the attempt on the highway had failed. Maddox's jaw tightened. Too many. Claire nodded once. Then standing here is a mistake. Whitaker let out a disbelieving laugh. "This is unbelievable. You still think you're directing the room?" Claire turned toward him at last. "No," she said, "I think someone else is." That silenced even him for a second. Officer Rachel Torres stepped in, trying to anchor the moment in something local, procedural, normal. "If there is a credible threat to the patient, I need specifics." Maddox reached into his inside pocket and pulled out his phone. He typed one-handed, fast, controlled. "I am getting them." Claire was already moving toward the elevators. Emma looked at Tessa, got the smallest nod, and followed without thinking it through. Voss swore under his breath and went after them. Mercer. Claire stopped at the elevator doors and pressed the call button once. He should not be alone. He is not alone. Claire looked at him. Not with people who understand what this is. Voss stared back at her for one beat too long, then stepped into the space beside her, as if he had made a decision he would argue with later. Behind them, Maddox's phone vibrated. He checked the screen and his face changed in a way that made Tessa's stomach drop. What Claire said. "Highway Patrol Preliminary," he answered. "Vehicle inspection just came in. Brake line damage was not consistent with the crash. Steering assembly tampered with before impact." The air around the elevator seemed to tighten. Voss exhaled once through his nose. "You're saying the accident wasn't an accident?" Maddox looked at Claire. "I'm saying someone tried to kill him before he ever hit our doors." The elevator arrived. They stepped inside together. Claire, Maddox, Voss, Emma before she could stop herself. Torres, 2 beats later, catching the doors with one hand. The ride up was too quiet. Emma stood in one corner, still wearing blood on her shoes, heart beating so hard she could feel it under the base of her throat. She looked at Claire and realized she had no idea what this woman's real life had looked like before Cape Harbor. Only that nothing in this elevator was new to her except the lighting. Maddox made another call as they rose. "Lock down the trauma floor," he said. "No press above lobby. No unauthorized movement. Pull any camera footage from physician entrance loading bay and service elevators in the last 90 minutes. He listened. No, not later, now. The doors opened on ICU. The floor was dimmer than the ER, quieter in the way only serious places could be quiet. Not peaceful, controlled. The lights were lower to ease pain and sleep. Machines spoke in steady electronic rhythms. The air smelled of antiseptic warmed plastic, and the stale edge of fear kept under better discipline. Luke Callahan's room sat behind glass midway down the hall. Ventilator moving, monitors alive. One nurse at the station, one hospital security guard nowhere in sight. Claire saw that absence first. "Where's the guard?" she asked. The station nurse looked up, startled by the cluster arriving all at once. "He went to check a disturbance in linen storage." A visitor reported someone screaming. Claire and Maddox spoke at the same time. "Bait." The nurse blinked. "What?" Claire stepped to the desk. "Listen to me carefully. Who has entered this floor in the last 10 minutes? The nurse looked shaken but trying to stay useful. "Transport, respiratory, one pharmacy runner, that's all I know. Any new admissions?" "No." "Any staff you don't know?" The nurse's face changed a fraction. "2 men in scrubs came off the far stairwell maybe 3 minutes ago. I thought they were float staff." Maddox's expression went flat. Voss turned toward Luke's room. "Lock that door." The nurse fumbled for the override control with unsteady fingers. Claire was already moving. She tugged at the collar of her scrub top and loosened the fabric at the shoulders. Underneath was a black, close-fit layer that explained suddenly why the oversized hospital scrubs had always seemed a little like camouflage on her. Emma saw Voss notice it too. "This is a hospital," he said, but there was no force left in the objection. Maddox reached down to his ankle holster and drew a compact pistol. He offered it to Claire grip first. Emma stopped breathing. Torres stiffened. "You cannot arm someone in an ICU." Maddox did not look at her. "Would you prefer we wait to see what they brought?" Claire took the pistol, checked the magazine and chamber in one fluid motion, then tucked it at the back of her waistband beneath the loosened scrub top. Voss stared. "Who exactly have you been hiding from?" Claire's eyes stayed on the far hallway. Not who. What people become when they are cornered. Down the corridor, the stairwell door eased open. 2 men stepped out wearing dark blue hospital scrubs and paper masks. Their hair was covered. Their pace was wrong. Too controlled, too deliberate. Not the loose fatigue of real staff at 3 in the morning. One carried a soft equipment bag. The other walked half a step behind with the loose shoulder posture of someone ready to turn fast. The station nurse sucked in a breath. Claire moved into the shallow alcove near an empty room and let the shadow take half her outline. The first man reached Luke's door. The second scanned the hall. For 1 second, no one moved. Not because they were unsure. Because they were all waiting to see which reality the moment would choose. Claire stepped out. "Stop." The first man froze. The second turned too fast. His hand went into the bag. Claire fired twice. The shots cracked through ICU like the end of the world. The second man dropped hard, clutching his thigh, crashing into the wall with a strangle-nanny crane. The first ripped a compact weapon free from the bag, wrapped in a towel to disguise its shape. He fired instinctively toward the muzzle flash. Glass burst from the side panel of an empty room. The station nurse screamed and ducked. Emma hit the floor behind the desk so hard her elbows skidded on polished tile. Torres drew her weapon. Maddox moved left, already angling for line of sight. Claire did not stay where she had fired from. By the time the gunman's burst shredded the doorway, she was already moving low and fast through the open room to his blind side. The hallway filled with alarms. A patient monitor shrieked from another room. Somewhere down the corridor, an elderly man cried out in confusion. The fire doors began to cycle with a mechanical warning tone. The gunman advanced 2 steps toward Luke's room weapon, up, trying to reacquire. He did not expect resistance in scrubs. He expected panic. What he got was Claire Mercer coming back through a cloud of drifting plaster dust with her body already committed to impact. She hit him hard at the waist and shoulder. The muzzle jerked up and rounds tore into the ceiling tiles. He lost balance. She drove through him, took the inside arm and put him on the floor with a forceful efficiency that looked less like a fight than a solution. The weapon skidded away. He tried to reach for it. Claire struck him once across the temple with the butt of the pistol, and his body went slack. The first attacker, the one she had shot, was dragging himself toward the dropped bag, blood smearing under one knee. His hand shook as he reached for another weapon inside. "Don't," Claire said. He kept reaching. She put the front sight on his face. "Don't." That stopped him. Maddox was in the hallway now, kicking the bag out of reach and ripping it open with his free hand. Inside sat a second weapon, zip ties, nitrile gloves, and a syringe case with no labels. Torres moved in on the wounded man, weapon steady. "Hands where I can see them." The man stared up at her over his mask, breathing hard, saying nothing. Voss stood in the middle of his own ICU, taking in shattered glass powder residue, the sharp stink of gunfire over antiseptic, and Luke Callahan's monitor still beeping through the sealed door. His voice came out raw. "My God." Claire did not look at him. She looked at Luke's room. The ventilator still cycled, pressure still held. The nurse who had locked the door was on the far side of the glass, white-faced and clutching the bed rail, but she had not left her patient. Good. Very good. The elevator at the far end of the hall chimed. Every weapon in the corridor came up at once. The doors opened on 4 Marines in field-ready uniform, and one man in a dark civilian overcoat with rain on the shoulders and command in every line of his posture. He stepped out, took in the corridor in one sweep, and went still when he saw Claire standing in ICU scrubs with a pistol in one hand, one intruder down at her feet and another bleeding under Torres's aim. General Daniel Callahan. The name did not need introducing. It arrived with him. His gaze moved past Claire to the room behind glass where his son lay bandaged and ventilated. Then back to her. "At ease," he said. Claire lowered the pistol by half an inch, but not all the way. She checked the corners of the elevator first, then the stairwell, then the far bend in the hall. Only then did she engage the safety and lower the weapon. "Sir." General Callahan came forward with 2 Marines peeling off automatically to secure the floor. One moved to the stairwell. Another checked the downed attacker. Maddox met the general halfway. "Attempted breach," Maddox said. 2 assailants, neutralized. "In a hospital," Callahan said. His voice was quiet, which made it sound colder. Voss stepped closer, trying to bring medicine back into the center of the room. "Your son is post-operative. Critical, but stable." They were trying to reach his room. Callahan's eyes settled briefly on Luke behind the glass. "I can see that." Then he looked at Claire again, and something older passed through his face before it disappeared. Recognition mixed with anger, relief, and unfinished history. "They told me you were gone." Claire's expression did not move. "I was." Callahan's jaw flexed, clearly not enough. Torres, still covering the wounded attacker, looked between them all with the dawning awareness that her jurisdiction had just collided with something much larger than a hospital shooting. "I need this scene secured," she said. Weapons bagged, statements taken. Nobody touches anything. Maddox gave her the briefest nod of respect. You'll have it. One of the Marines frisked the unconscious intruder and came up with another burner phone, a fake hospital ID, and a folded access map of the ICU floor. Emma, still behind the station desk with her pulse hammering in her ears, stared at the map and finally understood that this had not been improvisation. These men had known where they were going. General Callahan stepped toward Luke's room but stopped at the door as Voss blocked him gently with one hand. "Give me 10 seconds, Voss said. I need to make sure the spikes on his monitors were stress response only." Callahan held himself still by force. Voss entered the room. Claire stayed outside. Torres began reading the wounded attacker his rights. He asked for a lawyer almost immediately and then shut his mouth with professional discipline. That more than the weapons chilled Emma. These were not desperate men. These were practiced men. Maddox's phone buzzed. He checked the screen and looked up at Claire. "We pulled a message from Whitaker's phone." Torres glanced over. A warrant that fast. "We didn't need one for metadata linked to a federal threat package," Maddox said. Claire watched his face, read it. Maddox did. "She's here. Come get her." The hallway went still in a new way. Not the stillness of fear, the stillness of a puzzle piece sliding cleanly into place. Voss looked as if someone had struck him. He sent them. Maddox nodded once. 10 minutes before the breach. Torres's jaw hardened. Then he is no longer just a witness. General Callahan's gaze shifted toward the elevator as though he could already see through concrete and floors and politics to the man downstairs still trying to shape the story. "Bring him back," he said. There was no need to say for what. Maddox turned to one of his men. "Find him." The man moved at once. Inside Luke's room, Voss checked lines, lungs, pressure, neuro response, pupil size. When he stepped back out, his face had steadied. He held, Voss said, "No catastrophic change." General Callahan entered the room, then slowly, as if crossing a threshold into something more dangerous than gunfire. He stood beside the bed and looked down at his son. Luke lay pale, beneath warmed blankets, chest bandaged, thick neck-lined ventilator breathing for him in measured mechanical sighs. The force that had carried him through war and steel and impact had been stripped down to a monitor line and numbers on a screen. Callahan put one hand on the rail, not yet touching him. Claire watched from the doorway, her face unreadable. Emma, still shaky, moved to the station and began helping the ICU nurse reset alarms and calm the neighboring patient rooms. Work returned in small pieces because work always had to return. An old woman in room 7 was crying. A man down the hall wanted to know if he was being evacuated. A respiratory therapist arrived breathless and got turned away from Luke's door by a Marine who looked about 23 and already tired of explaining the new rules. It took less than 15 minutes for Whitaker to come back. He arrived in the company of hospital counsel and 2 local patrol officers who had not yet realized their instructions were stale. His white coat was gone. He wore a navy suit, now tie, straight hair combed like a man headed into a morning interview instead of the aftermath of a failed murder. He stopped cold at the sight of Marines in the ICU corridor. Then he found Claire. "There she is," he said, too loud, too eager. "Officers, that is the employee. I want her detained immediately." No one moved. Whitaker looked around, irritated by the failure of the world to keep following the script in his head. "She discharged a firearm in a hospital," he continued. "She performed an illegal procedure on a patient. She assaulted my resident. This is not complicated." Torres stepped into his line of sight. "Dr. Whitaker." He blinked at her. "Good. Finally. Take her." Torres held out her hand. "I need your phone." Whitaker's expression cracked for the first time. "What?" "Your phone." Hospital counsel frowned. "Officer, on what basis?" Maddox lifted the recovered screenshot on his device so all 3 of them could see it. "She's here. Come get her." Whitaker's face went blank, then frantic, then offended, as if the true crime here were someone daring to read his own words back to him. "That proves nothing," he said. "That could refer to anyone." Torres' voice stayed level. "It was sent to a burner recovered in the possession of the men who just tried to access Mr. Callahan's room." Whitaker laughed too fast. No, this is absurd. I was warning someone. I was warning legal. Maddox's tone did not change. You sent it before legal arrived. Voss looked at Whitaker the way surgeons sometimes looked at dead tissue, with accuracy and no affection. You nearly killed him in the trauma bay, Voss said. Then you tried to bury the person who saved him. Whitaker snapped toward him. You have no idea what you're saying. General Callahan stepped out of Luke's room then, and the corridor shifted around him. He came to a stop 3 feet from Whitaker. The difference in composure between the two men was brutal. Whitaker in polished panic. Callahan in absolute containment. My son is alive because of her, the general said. Whitaker tried one last time to grab control through language. Sir, with respect, she is unstable. She hijacked patient care. Callahan looked at him for a long second, then at the shattered glass still waiting to be swept the bleeding intruder on the floor. The Marines, the local police. Claire, standing in scrubs with dried blood at one cuff. Your problem, he said, is that you think everyone else is as small as you are. Whitaker opened his mouth. Torres took his wrist. Dr. Evan Whitaker. She said you are being detained on suspicion of obstruction and coordination with a violent felony, pending further charges. He jerked back. You cannot be serious. Torres twisted just enough to break his resistance without drama. One cuff, then the other. The click of steel sounded very clean in the hall. Whitaker's face flushed crimson. This is insane. My father sits on the board. Not tonight, Maddox said. Whitaker looked around wildly for support and found none. Not from counsel, not from the patrol officers, not from Voss, not even from Emma, who met his eyes only long enough for him to see that the room had left him behind. As Torres led him toward the elevator, he twisted to glare at Claire. You did this. Claire held his gaze steady as ever. No, she said, you did. The elevator doors closed on him. For the first time since the red EMS line rang downstairs, the corridor became truly quiet. Not safe, not yet, but quiet enough for everybody in it to hear Luke Callahan's monitor still beating out the fact of his survival through the glass. Claire stood in that quiet with the pistol now heavy against the back of her waistband, and the old familiar ache returning to her hands. Adrenaline was receding, not disappearing, just pulling away from the surface and leaving behind its receipts. Tight shoulders, dry mouth, a fine tremor deep in the forearms where no one could see it. Maddox approached first. You can hand me the weapon. Claire looked at him, then at the room behind the glass. Not yet. Maddox let out one slow breath and glanced toward General Callahan. The general did not object. He simply kept his eyes on his son, one hand resting at the bed rail, now close enough to touch, but not yet choosing to. There was something almost unbearable in that restraint. The man could command battalions, redirect aircraft, reorder continents with the right phone call. But in that room, in the blue-white ICU light, he was only a father standing beside the machine that measured whether his son remained in the world. Voss stepped back inside Luke's room and checked the drains, the dressings, the rhythm strip, the line pressures. When he emerged again, his voice was low and clipped. He'll hold for the next few minutes if nothing else changes. That is the best sentence I can give anyone tonight. General Callahan nodded once. It will do. Torres turned to one of the patrol officers and gave a short set of instructions about evidence control scene, photographs, and getting forensics to the ICU level without letting half the city wander onto the floor. Then she looked back at Claire. I still need your statement. You'll have it. Torres glanced at the pistol hidden under the loosened scrub top. And that. Claire pulled the weapon from her waistband, dropped the magazine, cleared the chamber, and handed both to Maddox grip first. The motion was smooth enough to unsettle everyone who watched it. Emma felt that in her bones. There were things Claire Mercer had forgotten about ordinary life that ordinary people never learned in the first place. Maddox took the pistol and holstered it without comment. The ICU nurse who had locked Luke's door came out from the room at last. She was young, dark-skinned, short, with one glove torn at the thumb, and a line of sweat dampening the hair at her temple. She looked at Claire in a way that mixed fear-gratitude and the blank exhaustion that comes after almost watching a man die twice in one night. "I stayed with him," she said, as if asking whether that had been the right choice. Claire met her eyes. "You did." The nurse swallowed and straightened by a fraction. General Callahan turned then, finally away from the bed. His face had not softened, but the line of his mouth had changed. Less command now, more cost. "Mercer," he said. Claire stepped into the room, leaving the others just outside. Luke lay under warming blankets with his skin drained to an almost waxen pallor. The ventilator pushed measured breaths into him. Each rise of his chest lifted the thick bandage and lowered it again. One side of his hair had been shaved for access, and the remaining dark strands lay damp against his forehead. He looked younger, unconscious. Smaller, too. Stripped of rank and voice and muscle, and all the hard edges that let men pass through the world as if they were built to survive it. General Callahan watched Claire from across the bed. "They told me you were dead." Claire's face remained steady. "They were wrong. They told me you walked away." "I did." His jaw shifted. "You did both as far as anybody trying to find you was concerned." Claire looked at Luke's pressure line instead of the general. That was the point. The general was quiet for a long moment. Outside the glass, the corridor moved in low, controlled pulses. Marines at each end. Maddox on the phone again. Torres interviewing the ICU nurse. Voss arguing with hospital counsel in a voice so cold it sounded almost polite. Then Callahan said he recognized you in the trauma bay report. Claire looked up. "You read it already." "I read everything that concerns my son." She believed him. The general rested one palm against the rail. "You were with his unit in Helmand." Not a question. Claire let the silence answer first. Rain tapped lightly against the far window of the ICU, softer now than it had been earlier, as though the storm itself had tired of violence. "Yes," she said at last. "He was 19. Yes. He said you cut open a man in the dark with a flashlight in your mouth and a corporal holding up a mirror because the generator failed." Claire's eyes drifted to Luke's face. "That sounds like him." General Callahan watched her more closely now. "He said you stayed with 6 wounded men after the extraction went wrong." Claire did not answer. "He said one of them was supposed to be you." That landed. Not visibly. Not in a flinch or a breath. But the line of Claire's shoulders changed the way a line changes when a wire pulls tight under too much weight. "The reports said you were listed among the dead," he went on. "Later, they said the list was corrected. Then they said you were transferred stateside. Then you disappeared." Claire's gaze stayed on Luke. The reports liked changing their story. Why? This time she looked at him. Because he had earned the answer more than most people ever would. Because it was easier for them if I stopped existing in a way they had to explain. The general absorbed that without blinking. "That is not the same as why you left." "No." "Then why?" Claire's throat moved once before she answered. "Because there are only so many times you can hold a man's heart in your hand and send him back into the same machine that broke him." Callahan said nothing. So she continued, not because she wanted to, but because the room had earned a measure of truth, and because Luke was lying between them, alive enough to demand it. That operation in Helmand was not the first time command made a bad decision and called the consequences acceptable. It was just the first time I stopped being able to translate that into duty. We had boys ripped open because someone needed clean timing for a briefing slide. We had medevac delays while people argued jurisdiction. We had contractors who made money every time someone bled on schedule. I stitched them. I cracked chests. I bought time. And every time they survived, someone higher up used the survival to prove the system worked. The general's face had gone still. Claire's voice never rose. That made it worse. It did not work. We worked. The system harvested that. Outside the room, Voss had stopped arguing with counsel and was listening now without seeming to. Maddox, too. Emma stood motionless by the station desk, hearing pieces of Claire that did not match any version of the quiet nurse she had known. General Callahan's eyes stayed on Claire's face. "You think I did not know. I think you knew enough to live with it." Something old and dangerous flickered in his expression, then settled into something harder than anger and nearer to grief. "My son is alive because you were still willing to do the thing the system does not deserve," he said. Claire looked back at Luke. "He is alive because he was not done fighting." General Callahan studied her another second, then nodded once, accepting the deflection without respecting it. Luke's fingers moved. Both of them saw it. A tiny twitch first, then a stronger flex under the tape securing the pulse oximeter. Voss was inside the room before either of them called for him. He stepped to the bedside, checked the sedation level, watched the monitor, and touched Luke's shoulder with firm, controlled pressure. "Luke, can you hear me?" The eyelids fluttered. Not fully, just enough to show movement under them. A ripple passed through the room, down the hall, into the bodies of every person watching through the glass. Nothing in hospitals could electrify a floor like the first sign that the person they had fought for might actually come back enough to witness it. Voss leaned closer. "Luke, if you hear me, squeeze my hand." The right hand twitched again, then curled weakly. General Callahan bent over his son at once. "Luke." The eyelids opened halfway, clouded, drugged, uncertain. The gaze wandered first to the overhead light, then to Voss, then to the shape at the bedside that his battered brain recognized faster than language. His father. Something changed in his face, not a smile, a loosening. A recognition so raw it almost hurt to watch. Then his eyes shifted past Callahan and landed on Claire. He stared. The ventilator stole speech. The tube kept his mouth open just enough to make the effort painful. But the recognition there was immediate and unmistakable. He knew her. Not from the trauma bay, not from the rumor of her. From somewhere older. His hand lifted a fraction from the sheet. Claire stepped closer, instinct overriding everything else. "Easy," she said. "Do not fight the tube." Luke's fingers moved toward her. She took them lightly in one hand. His lips shaped a word around the endotracheal tube. Mercer. General Callahan looked between them and said nothing. A sheen of tears touched Luke's eyes, not from sentiment exactly, more from overload. Pain. Sedation. The stunned animal disbelief of a man who had been almost gone, and now found an old ghost standing by his bed in civilian scrubs. Claire's face softened by the smallest degree, enough to be more intimate than a smile. "You're in Cape Harbor," she said quietly. "Post-op, you have a tube in. You're safe for the moment. Do not spend your strength fighting the machine." His brow tightened. He was trying to ask something, trying to push through sedation and restraint and the body's ruin. Claire leaned closer. Later, Luke held her gaze another beat, then drifted under again as the medication drew him back towards the dark. The hand in hers slackened. She let it rest on the blanket and stepped away. General Callahan did not speak until the monitor and ventilator had returned to being the loudest things in the room. He remembered you before he remembered where he was. Claire kept her eyes on the IV pump, now not him. Marines remember the people who keep them alive. That is not all he remembered. "No," she said, "it isn't." They stepped back into the corridor where the world was already trying to convert the moment into process. Simon Graves arrived, first gray-faced and sweating, despite the chill trailed by hospital counsel and a woman from the board in an expensive suit that looked obscene under ICU lighting. She took one look at the shattered glass, the Marines, the photographed evidence markers, and adjusted her tone in real time. "General Callahan," she said, "the board sends its concern." "The board can send functioning doors next," Voss said. Her lips tightened. "Dr. Voss, now is not the time." "No," he said. "Now is exactly the time." We had a trauma bay visible from a waiting room. We had one security guard on a high-value patient. We had an attending physician coordinating with armed intruders. Pick whichever failure you would like to address first. Graves stepped in with bureaucratic panic. "Nathan, please, we are trying to control the damage." Voss turned on him with enough force to make Emma flinch from 20 feet away. There is no controlling damage while pretending it is branding. A man nearly died twice in one night because this place worships appearance and tolerates rot. The board woman folded her hands. We will conduct a full internal review. Torres looked up from her notes. You will cooperate with the criminal investigation first. Maddox ended another call and slid his phone into his jacket. Whitaker is at county booking. His father has resigned from the board, effective immediately. That cut Graves off at the knees. The board woman's face hardened in a way that suggested this was the first truly credible fact she had heard all night. Resigned. Yes, Maddox said. Apparently, he found the text logs persuasive. Voss gave a short, humorless exhale. Claire stood just outside Luke's room listening to all of it without seeming to. The adrenaline crash was reaching her now in quieter ways. The fluorescent lights were too bright. The skin on her hands felt stretched and tender from scrubbing. Under the black thermal layer and fresh loner scrub top, someone had finally pressed on her. Every muscle along her back had started to tighten in protest. Emma approached with a paper cup of coffee, and the kind of care usually reserved for offering water to survivors. I know it's terrible, she said, but it's hot. Claire took it. The cup warmed her raw hands through the paper. Thank you. Emma looked up at her eyes, still too wide for normal life. I thought you were just really calm. Claire took a sip. The coffee was awful. That, too. Emma laughed once, small and shaken. Then the tears came abruptly, not dramatic just there. I handed you the retractor. Claire looked at her. Emma wiped at her face with the back of her wrist. I keep replaying it. If I'd frozen. But you didn't. I almost did. Claire held the coffee in both hands for a moment. Almost is still movement. Emma swallowed hard. I've never seen anything like tonight. No, Claire said. Most people shouldn't. Tessa came up beside them. Arms crossed. Eyes red-rimmed from fatigue but still iron under it. Hospital administration wants names, time sequences, and a version of reality that doesn't make them look incompetent. Claire took another sip of coffee. That will disappoint them. Good. The board woman approached, then slower than before, as if she had decided fear was less effective than diplomacy. Colonel Mercer. Claire looked at her without expression. Dr. Mercer. A brief pause. Dr. Mercer, the hospital is grateful for your intervention. Voss made a sound that was very nearly a laugh. The woman kept going. We understand that your role here was not accurately represented in our internal systems. That will need to be corrected. Claire's gaze stayed level. Will it? Obviously, because it matters now. The woman did not answer immediately. Claire spared her the struggle. It mattered an hour ago. General Callahan stepped out of Luke's room, and the conversation changed shape around him. He looked at the board woman, then Graves, then Voss, and finally Claire. This hospital nearly lost my son because the wrong man had power, and the right woman was pretending not to. Nobody rushed to fill the silence after that. Callahan continued. I do not care what title she carried on your payroll. I care who saved him. The board woman adjusted her jacket. General, we are not disputing her skill. Good, he said. Then do not insult us with procedure masquerading as courage. Graves tried a softer angle. Dr. Mercer, surely you understand the complexity here. Credentialing, liability media, exposure, federal involvement. Claire met his eyes. I understand exactly how people like you use complicated language when a direct truth would threaten your comfort. He flushed. Voss looked at Claire for a long moment, then said the thing that stopped even the Marines from shifting in place. The trauma director position is vacant. Graves turned sharply. Nathan. Whitaker's name did not need to be spoken. Everyone on the floor knew what Voss meant. Claire's face did not change. I am not interested in replacing him. Voss folded his arms. I am not interested in replacing him with someone polished. I am interested in replacing him with someone useful. The board woman stepped in at once. That is not a decision to be made in a hallway, no, Voss said. But it is the only place honest enough for it. Claire looked through the glass at Luke again. The ventilator cycled. The monitor held. For the first time all night, nobody in the room with him was lying about the state of things. "I did not come here for leadership," she said. Voss's answer was immediate. "You came here to disappear." Her eyes cut back to him. He held her gaze. "That option has expired." General Callahan said he is right. Claire's mouth tightened. "That does not make him pleasant." "No," Voss said, "but it makes me correct." Emma watched the exchange with the stunned clarity of someone realizing that the whole shape of the hospital might be changing while she stood there in dried blood and cheap sneakers. The board woman glanced between Claire and General Callahan and recalculated again. If Dr. Mercer were to remain in any formal capacity, there would need to be conditions. "There already are conditions," Claire said. "Such as..." Claire set the empty coffee cup on the counter beside the nurse's station. "No retaliation for escalation from nursing staff. If a nurse says a patient is crashing the room, listens. Bedside ultrasound available in trauma for trained nursing and residents without ego-based gatekeeping. Mandatory debrief after every major resuscitation. No physician protected by donor status or family name when they endanger patients. Security review of all critical care floors. Trauma bay privacy reworked by tomorrow, not after a committee. Residents trained to hear the quietest, competent voice in the room, not the loudest title." The boardwoman opened her mouth. General Callahan spoke first, approved. She turned toward him. "General, with respect, hospital operations are not under military command." "No," he said. "But your need for donations may be." That ended that. Graves looked as though he might be ill. Torres capped her pen and slipped the notebook back into her pocket. "I've heard enough to know this hallway is still a better court than most." Maddox finally allowed himself the smallest change in expression. Not a smile. Something adjacent. Claire looked down at her hands. The skin was cracked pink around the knuckles from too much soap. Faint lines of dried blood remained in places no hurried scrub could fully erase. They looked like ordinary hands under hospital light. Capable hands. Human hands. The kind that had stitched, steadied, struck, and held all in one night. General Callahan watched her seeing them too. "My son is alive because those hands stayed where other people hesitated." Claire did not look up. "They are not a gift." Callahan's voice softened by almost nothing. "No, they are a responsibility. There is a difference." Outside, dawn had begun to thin the darkest blue from the windows. The storm had exhausted itself into steady rain. Somewhere below the lobby was still crowded with cameras and statements, and people who wanted disaster simplified into the shape of a headline. But up here on this floor, the hospital had narrowed back down to its oldest truth. A patient. A body. A room full of people deciding what mattered more than reputation. Voss pushed off the counter. "You need rest." Claire glanced at him. "I need to know he'll hold." "He will hold whether you stare at him or not." I have had that sentence become false before. Voss absorbed that and nodded once. "Then take an hour in the call room next to mine. I'll wake you if anything changes." Claire looked like she might refuse on principle. Emma, surprisingly, was the one who broke through. "You can hear every monitor from there," she said. "The wall is paper thin." That got the faintest shift at the corner of Claire's mouth. "Fine," she said. 1 hour. Tessa snorted. "A whole hour. We're spoiling you." Claire turned then and unclipped the badge still hanging from the pocket seam of the loaner scrub top. Claire Bennett R.N. The false name that had bought her anonymity. The name patients had trusted. The name Whitaker had used like an insult. The name that had done its job until the moment doing the job meant letting a man die. She turned the badge once between 2 fingers, then dropped it into the trash can beside the station. Plastic hit metal with a dull, final tap. Emma stared at the bin, then back at her. "So, what do I call you?" Claire met her eyes. "Dr. Mercer." Emma nodded slowly. "Okay. Not ma'am, not colonel, not ghost, not miracle. Just doctor." That felt right in a way the whole hospital could understand if it chose to. An ICU alarm sounded from another room. Tessa was already moving. Voss followed. Torres headed toward the elevator to finish processing the evidence downstairs. Maddox stepped off to take another call that likely involved a level of consequences no one in Cape Harbor wanted to imagine. General Callahan remained beside his son's door for one more second. When he looked at Claire again, the command had not left him, but it shared space now with something harder to name. "You saved him twice tonight," he said. Claire answered the only way she could live with. "I kept him in reach." Callahan nodded. "That's enough for now." She watched him go back into the room. Then, because hospitals do not suspend reality out of respect for revelation, an overhead page called for help in the emergency department. A possible stroke in triage. Chest pain in bed 3. Security needed at the main entrance. Blood bank asking for confirmation on usage after the trauma activation. Tessa looked back over her shoulder from halfway down the hall. "You hear that?" Claire did. The living kept arriving. The injured kept needing. The building had not been redeemed by one dramatic night. It had simply been forced to show its bones. Claire picked up the fresh stethoscope someone had left for her on the counter and slid it around her neck. The motion surprised Emma more than the gun had. It looked right there. It looked inevitable. Voss paused near the elevator and glanced back. Coming. Claire looked once through Luke's glass wall at the steady green line and the rise of the ventilator. Then she turned toward the stairwell leading down to the ER. "Yes," she said. They went together. The stairwell smelled of concrete rain damp and old paint. Every step downward brought back the noise of the emergency department. Phones, wheels, voices. The constant argument between urgency and exhaustion. By the time they pushed through the doors at the bottom, the night shift looked up all at once. The whole room changed, not in the theatrical way people imagined awe. In the practical way, rooms changed when the person who had proven useful returned, and everyone knew it. Tessa walked straight to the board, scanned the waiting list, and started assigning with the speed of old instinct. Possible stroke in triage. Chest pain in 3. One psych hold trying to leave. And somebody tell the front desk if a single reporter gets past security, I will personally drag them back outside. Voss looked at Claire. Doctor. She did not answer to the title immediately. She answered to the board. To the names, to the order of risk, to the work. Ultrasound to 3, she said. CT alert for triage, labs on both. Tessa, I want hallway B cleared for movement. Emma, with me. Emma blinked, then straightened so fast she nearly dropped her pen. Yes, Dr. Mercer. There it was. Not a coronation, not a speech, just function accepted in real time. Claire stepped into Trauma Bay 1 on her way to bed 3 and paused for half a breath. The room was clean again. Fresh sheet, bare tray, bright light. No blood left on the floor. If she had not been inside that chest with her hand around a failing heart, the bay might have looked untouched. Hospitals were good at that kind of lie, cleaning the evidence without changing the truth. She looked at the space once, then turned away from it. The television in the waiting room still glowed. The lobby still churned. The internet still fed on fragments. But none of that was inside bed 3, where a middle-aged man pressed 2 fingers to the center of his chest and tried to tell himself he was probably wasting everyone's time. Claire entered and the man looked up. You the doctor? He asked. She met his eyes. Yes, that was enough. Outside, rain washed the parking lot in silver streaks. Upstairs, Luke Callahan slept under sedation with a repaired heart and a father in the chair beside him. Somewhere downtown, Evan Whitaker was beginning to understand the shape of a room that no longer bent around him. Somewhere in Washington, people with clean hands and expensive suits were opening files they had hoped would stay buried. But here under fluorescent light, none of those stories mattered as much as a blood pressure cuff tightening around an arm and a nurse waiting for orders and the stubborn pulse of the next life, asking not for spectacle but for skill. Claire Mercer put the probe to the man's chest and watched the screen come alive in shades of black and gray. Take a breath, she said, and the department moved with her.